Good afternoon to everyone present here with us today. This is Shreyan from IGCP, today's moderator. I would like to welcome all the viewers who have joined our platform for better exchange of knowledge that is going to be shared by our keynote speaker, Doctor, for today's session. With much pleasure and honor, I would like to welcome a very renowned doctor, Dr. Uday Kumar Jadhav. Sir is MBBS, CHIV, PDCR, AFIH, infectious disease consultant in charge at ART Center, LNT, MDACS, Mumbai. Owner of Life Care Clinic and Total Care in HIV AIDS, Aurangabad, Maharashtra. With the help of Sir and his wonderful insight, we will be taking a close look on today's topic, which is ART in adolescents and young adults with HIV infection. Now, without any further delay, I would like to welcome Sir at our forum and would like to hand over the session to him. Over to you, sir.
Thank you very much. Good afternoon, everybody. Uh, Today we are going to deal with a very important topic, which is upcoming, and we need to have that proper knowledge of this. That is antiretroviral therapy (ART) in adolescents and young adults with HIV infection. As we know, adolescents are the people who are from the age of 13 years to 18 or 19 years, and young adults are the people who start from 18 to 25 years. So ART means antiretroviral therapy, the therapy initiated for HIV positive patients. So what is HIV? We know that human immunodeficiency virus (HIV) is very common in the young adults and it's been increasing day by day. As we know, young adults or adolescents, they are having high sexual activity, and the spread of HIV is very common with this kind of high sexual activity. Sexual activity uh, are the things which happen between various kinds of couples. They can be male and female, or they also can be male and male, which is also called as heterosexual and homosexual couples. And this kind of sexual activity is driven so that they get into kind of unprotected sexual behavior, which adds to the increase in the number of sexually transmitted infections. These candidates are excellent for intervention and prevention programs, which can be implemented. However, these age group are not mentally mature. Secondly, they are not financially secure. Therefore, if even if they are diagnosed, they are very difficult for them to keep them retained in the care. So, young adults have a lot of issues which are not particularly seen or which are a lot of times missed, and hence lot of times these people spread the infection more rapidly than the other sort of age groups. So the Center of Disease Control and Prevention, they had the data from 2015 and 19, which said that there was a decrease in the 15% of HIV infection in the age group 13 to 24. Now, why there was a decrease in the infection? The decrease in infection was due to promotion of safe sex or not using any needles. So, in this particular age group, as we know, though the new people, young adults, the age population is growing, but since they have been educated at the peer level, they people they are now getting less infected due to use of single-use noodles and the programs run to understand what is sexuality, what is sexual behavior, and how high-risk sexual behavior can lead to more kind of infection. CDC has estimated that the 21% of the people diagnosed infection were aged from 13 to 24 years. Therefore, early intervention, including prevention strategies, counseling, and HIV testing, plays a key role in treating these adolescents and young adults. So, right now, we have in the prevention strategies in which we have condom promotion. Also, we have strategies we find the high risk group. Also, you find the people who are traveling a lot, and so we if proper counseling is done with the people who are having sex, males having sex with males, MSM people, or transgender, or people who are injection drug users, or other ways where there are rave parties, use of drugs, then these things can lead to decrease in the amount of infection. In India, we don't have a proper data, but from the areas that we study, we understand that a lot of people can decrease in the HIV infection. So, in the contrast, we have also seen that the perinatal HIV infection is relatively rare, and most perinatal infected youth are now older and aging out of the pediatric care. So, as we know that the people in India with the ANC, antenatal care, they are asked to do HIV testing. That is done in the second trimester, third, first trimester. If not done, if it is the third, we should have some kind of batch or some kind of number that provides that this particular person had been tested for HIV. If that is tested, then we go for antenatal care of the HIV of these people, and when it is done, find out that HIV infection can be prevented by providing antiretroviral. That's why perinatal HIV infection is relatively rare now, but we also find that from the pediatric age group, the children are going into adolescent group. So many of these young adults are on treatment experience and can harbor significant HIV resistance, mutations, and also they can have comorbid uh, associated diseases and hospitalization, which pass treatment. Also, sometimes they have mental health issues, and they are reported about 70% of this particular infected youth. So this complicates the treatment and adherence of the patient. As we know, adherence stands for the prime or soul of the treatment of ART. If there is a proper adherence, and definitely the person can get decrease in the HIV viruses, and the person can stay healthy for a longer period of time. So adults and young adult population, which present the 40% of the new HIV infections globally. In India, adolescents have more lot of part in sexual activity. Also, nowadays they are financially independent. Also, since due to India is becoming a nuclear family network, lot of parents cannot pay attention to their children, and these children, when in cities, they go to pubs, clubs, and they indulge into high risk behaviors, and therefore this high risk sexual behavior, and lack of engagement with the healthcare services, they can affect adherence to the antiretroviral therapy. So there is a lot of chance a young person who has now grown and who doesn't who is HIV positive on treatment, and he or she may or not having parents who are not ready to take care of the children. These uh, these uh, these kind of adults, they can indulge in high risk sexual behavior, and thus they can transmit the infection. As their treatment experience, they can be having lot of viral replication. Therefore, the spread of HIV to other negative people can be there. So, despite adherence to IRT and being critical controlling viral replication, maintaining health and reducing the onward HIV transmission is difficult. So there is limited data on ART adherence among AYA globally. Now, a lot of times we have seen that these young adults indulge in tattooing. As we know, tattooing is also a high risk factor which can spread hepatitis B, which can also spread HIV. So, this kind of behavior can lead to more rise in the HIV cases in the young adults. So, as we are in the third decade of the HIV/AIDS epidemic, there are about 34 million people who are living with HIV in the world, now of which 5 million are aged between 15 and 24 years of age. So, adolescence is a period of a special period in which the mentally, physically, emotionally maturation begins, or they try to get their own kind of field, and in which we commonly individuals undergo behavioral experimentation, identity formation. They are having risk taking and face difficult choices even on romantic relationships, sexual behavior, also the use of alcohol and smoking and other recreational drugs which are easily available in various parks. Therefore, these children or these people can get indulged or they can get off into higher activities which can have more stress on this. So this kind of behavior can lead to suicidal tendencies. This kind of undergo experimentation can lead to more kind of HIV infection and a lot of other things. Also, these young people have poorly developed life skills and often lacking in worldly knowledge and financial autonomy. So there is a lot of rage, there is a lot of depression, there is a lot of mental satisfaction or mental stability that helps them from getting a proper workup. This limited access to the health facilities and prone to sexual coercion and peer pressure. Therefore, adolescents have been described as the fulcrum and center of the epidemic. These are the people who are more prone to HIV infection. These are the people who like to have parties. These are the people who like to go to the beaches. And when they go to such kind of parties, they can have more infection. So within 42% new infections in this group in 2010, we can say that under the cover, lot of people can lead to HIV infections. Also, it is said that when there are situations like war, as we know in Bangladesh or in other countries where there are situations where there is not a proper kind of well-being in the society, lot of chances are there which can lead to a more number of HIV infections. So adolescents have been frequently recognized as vulnerable groups to becoming infected or being marginalized from the mainstream healthcare tools. So we need to do something so that we can take care of these children in a proper way so that we can understand what are their psychological needs, what are their physical abilities, and how we can handle them to make them in a proper futuristic well. So, despite the dramatic improvements in the survival and the marked reduction in the transmission through the antiretroviral therapy, the sustained effect depends on high levels of adherence, which is usually more than 95% of total oral dosing. So as we see that this kind of children, when they are people when are working, they feel that if they are working late at night in a PPO or take PPO or in some kind of areas in which they need to be with their parents, it's difficult for them to take the pills at the time. But these particular things also when they are having some Saturday or Sunday, they go to party with the rest of them. Then also the level of adrenaline increases. There can be kind of alcohol or smoking or other kind of recreational drugs which can also decrease the adherence. So poor ART adherence increases the risk of viral drug resistance. So virus gets smart, it becomes overflooded, and therefore it can highly chances of getting infected to other people as well as having some opportunistic infection in the same person. So the limit treatment efficacy leading to the disease progression and reduces the future therapeutic options as well as increasing the risk of transmission due to the unsuppressed viral replication. So ART adherence is a prime thing in ART management. So if there is no ART adherence, then definitely, though we have improved the uh, treatment management, survival reduction, survival improvement, but there can be reduction in the viral transmission, viral enterotherapy, which can increase the risk in this particular adolescent age group. So, in the publication of HPTN 052 study, it was published that there is a paradigm shift in HIV prevention approaches to using ART strategically for all people living with HIV to significantly reduce the risk of onward viral transmission. But successful viral suppression among the four risk-taking groups, which include the adolescent, young adults living with HIV, we should have a renewed focus. So, a lot of time our focus was only on the high risk core group, like the people with MSM or the people who are working in the brothel and otherwise travelers, sector travelers. But right now, the key for taking control of the HIV epidemic is the young adults and the adolescents. So we should understand their mind, their body, so that we can do the needful, so that the epidemic of HIV would be under control. So there are mathematical models which have explored the potential elimination of HIV transmission. Everybody now and then tries to say that we should why cannot we eliminate HIV? We have landed the space vehicle on the Mars, on the moon. Why not we can do the work with the HIV transmission? But there are my models which prove that we can certainly cover it. But the universal HIV testing approach, accompanied by immediate ART for all positive HIV individuals, is the only key that we can do. So we have a process in which we ask the people to come and get tested, but we should have some kind of other approach also, in which we can test people with who are risk of having HIV, people who are risk of having getting the HIV or transmitting to others, and this must include the AYA. If it is to confer a population level effect. If we do not do that, definitely the India as a country divided into rural part and urban part. Urban part youth have other part of have a different style of living. Rural part youth different style of living. But still, as we are connected with the age or mobile or knowledge, everybody tries to get into some kind of activities which are which are or which may go into difficult high risk behavior. So, what is the key for this? Adherence is key for this. A few studies on adherence show that the access to the antiretroviral and adherence is lower in adolescents. That is the adult population. Why it is low? Because the adolescents are not ready or they are not stable, they are not financially for physically fit. They are still finding their partners. They are still finding a good place to live, a home to live. No secure job. Therefore, the adherence is lower. So there has been one previous review of ART adherence of HIV which showed that the rates ranging from 28.3 to 69.8 is in the US. What we require is 95%. So this aims to find the what kind of things that qualify to understand or the lack of adherence in the AI at a global level. And this lack is there due to non-secure jobs, or there is a futuristic workup in this. They do not have a proper partner or a committed life in this particular life with also habits or pressure of parties, rave parties, alcohol, recreational drugs leads to decrease in the adherence, leading to high risk behavior and infection. So this kind of treatment we can be properly treated with continuous antiretroviral therapy, ART therapy, and viral suppression. So most people with HIV achieve a life expectancy close to that of the normal people, people without HIV. However, there remains a mortality gap primarily due to cardiovascular disease and cancer. These kind of infections are there that can be the part of this. This can be worked up because the newer drugs, now as we know, from the efavirenz, we have jumped to dolutegravir, and dolutegravir having low pill burden as well as it has some part in which the virus can be controlled. The genetic barrier of resistance is high, so people do not what you call get more kind of opportunistic infection in these particular drugs, newer drugs, bictegravir, other drugs. But they also lead to high amount of sugar or obesity, which can lead to diabetes or cardiovascular diseases. Most of the people think if my CD4 is good, or viral flu is under control, then definitely I don't have any mortality issue in the future. But that is not true. We as physicians find that a lot of people have issues which can be the cardiovascular or endocrine issue which can lead to higher morbidity in these people. So we need to understand, we need to search, we need to be having healthy habits. Healthy habits is having good sleep, good night sleep, having a diet in which you feel hungry and also you are mobile. If you can mobile in your life, definitely the amount of part of the sugars they are utilized is leading to good amount of power in your body. So there are various antiretroviral therapy considerations. Now, as we know, in the post-pubertal adolescents, there is a event called a sexually maturity rating. So, sexual maturity rating is something in which there is a level of 1 to 5, and in which from level 4 and 5, they are properly matured, their bones are matured, and these people are given adult dosing. And post-pubertal youth for perennially affected may also use adult antiretroviral therapy treatment guidance. So we should also understand that how the person is sexually mature. This gives the proper dosing of the person and therefore the proper values of patient can be there. So special consideration may be needed in perinatally infected patients as they are often more treatment experienced and may have developed a significant burden of antiretroviral resistance. We should look out why these people are not having them. So I have a child who is perinatally infected. The child is about 22 years of age, but I face that the child or the person is not developing in the bone maturity. The height is compromised, the weight is compromised. So these particular things should be looked up, and after looking into them, you can definitely find out what are the issues with them. Also, newly diagnosed patients should begin a preferred regimen when possible. So there are various regimens we, as we know, that are there for the treatment management, but we should understand they should be given under the doctor's guidance. Important part is puberty. Puberty has a direct effect on how a drug is metabolized and on the drug's pharmacokinetic properties. Therefore, doses of medication for HIV infection should be based on the SMR, also known as Tanner staging or puberty, and not just on age alone. So, a lot of times we consider only the age. Also, there are genetic workup like the people who are Hispanic or other genetics workup or Africans or Europeans, they have a different body structure than the Indians. Definitely, the dosage are different. Adults in early puberty, that is SMA stage 3 and less, should be on pediatric dosing schedules found in pediatric treatment guidelines, whereas those in the late puberty, that is SMA stages 4 and 5, should allow adult dosing schedule. Now comes the important part, that is pregnancy. As we know, lot of adolescents, when they're going with the young adults, they are searching for, when they get a job, they're searching for wives or for partners. They have lot of difficulties and how they can find a proper life partner. Most of the people, children, more patients who come to me, they ask, can I marry a HIV negative person? Now, marrying a HIV negative person can vary depending on the choice, but then would a HIV negative person be ready to marry a HIV positive person? This particular thing can be worked out only if there is a consensual workup with the both. If not, we should go for HIV positive person where we can have HIV negative children. So the possibility of pregnancy should be discussed with all adolescent females. The patient should be counseled on options to prevent pregnancy as well as potential for drug interactions with hormonal contraceptives. Hormonal contraceptives are not that much welcome for the people with HIV, and therefore we should understand the do's and don'ts of this. Guidelines for use of antiretroviral agents in HIV infected adults and adolescents provide further information on drug interaction. In general, oral contraceptives have significant interactions with the protease inhibitors, efavirenz and albuterol, and long-acting injectable contraception is compatible with protein inhibitors and NART. But we have a limited data with the integrase inhibitors. So we should understand what kind of hormonal workup we are working with so that the drugs don't hamper it. Also, mental health is one of the issues that we have. We have lot of issues in which mental health points as very important part. There are a lot of things in which we need to work on. We should know the global severity index GSI with the gender and age specific norms. So GSI reflects an overall evaluation of a respondent's psychological distress level. Clinically indicative scores were age and gender norm. So if a person is not mentally healthy, definitely there are a lot of things we should work on to find out the best. Also, lot of children have issue of substance use, substance abuse. They can be alcohol, there can be smoking, there can be all other things. So we have a test called an assist, in which the alcohol, smoking, substance involvement screening test is done to assess such behaviors. It's an 8-item questionnaire that assesses the frequency and consequence of substance use. So we can use that to understand what is the problematic workup and the problem that is solved. Also, sexual behavior and activity is one of the things the adolescents are worked up. So yes, there are a lot of things we find out in the research, and these participants' sexual partners, frequency of condom protected and condomless sex, oral sex, vaginal sex, and anal sexual activity with HIV infected and HIV negative or unknown status female and male partners during the past 3 months. So these are the things one should look up in adults and adults and answer the therapy based decision. So we cannot just blindly give adults and adolescents ART treatment as we think it is for the adults. These children or these people have lot of issues that should be worked up in the future, the present, and the past. And this particular workup helps us to make them more physically and mentally healthy. And the treatment of ART then comes into fulfillment. Just starting a pill for a patient who reported HIV positive doesn't treat the patient. There are issues related with this particular population, as it covers 40% of the total HIV infected population. We, as a HIV physician, should understand the needs for in detail of treating these particular patients, so that we can avoid a lot of issues that come up further in the in the treatment management of this particular infection. Thank you. Thank you very much.
Thank you so much, sir, for this wonderful presentation. We do have some questions, so if you like to take that up.
Okay.
So, sir, the first question is, what are the key factors to consider when initiating ART in adolescents and young adults with HIV infection?
As we discussed, the key factors is the age of the patient. Secondly, the patient should understand the HIV positiveness, how it affects the body, and how it can affect the other person. Yes. If it is a if it is an adolescent, then the parent who is taking care of the person, what is dependent on, and how the drugs which they are provided are taken, what is the well, physical or physiological age of the person and mental age of the person, and how these drugs, when taken, would affect that person. We should also consider how the person will grow in the next few years. What are the sexual behaviors? Does the person is under is some influence that can hamper the treatment management, or is there any kind of any endocrinological diseases or disorders that are important to know? And also, we should also know that what kind of peer group the person is in, which can help us to understand the substance abuse or other things uh, that can lead to lack of adherence to that particular person. So keeping in the mind all the things of the person, personality of the person, can be a good judge for proper management of the treatment. Yeah.
Then the next question is, sir, how do we address concerns related to drug resistance or previous treatment failures in this gap?
Yeah. So the people who are perinatally acquired HIV infection, when they are taken the treatment for more than 10, 14 years, there are chances these people can sorry can have drug resistance. So proper monitoring of the HIV virus load and the CD4 can help us to determine the person suffering from drug resistance or not. Just a person being asymptomatic does not define the variation in the CD4 and the virus load. Sorry. So we have to study the patient as a whole. We also see the bone maturity, the age maturity, how the person is maturing, mentally as well as physically, and how he is coping in his daily life. A lot of behavior changes, patterns, and also some kind of test can help us to find this. We also need to understand the sexual behavior that the person is in, which in there are things which can have high risk behavior leading to more resistance when the new resistant virus can enter from other person, or also understand what kind of new infection the person is getting in the recent past, so that we can find out what steps should be taken to find out resistance of HIV in that particular person.
Thank you, sir. There is one last question. What strategies can be used to improve ART in adolescents and young adults given the psychological challenges they face?
Yes. So whenever a person who is in that particular age group from 13 to 24 years, these people are not mentally or physically stable. They are developing, they are growing. And when they are growing, they have lot of opportunities that can help them. Also, they have a lot of risks that can delay their further growth. So these particular issues, as I mentioned in the lecture, sorry, we should have understand that these people, while growing physically as well as mentally, face challenges in their peer groups, in their circle. Then, when they're maturing sexually, these people want to have uh, partners or want to have friends who can indulge in activities with their peer. And we, as a person, as per the living standards of the groups, urban area, rural area, we should find out from them what kind of activities they like. We should become like them to understand what kind of activities they are facing, what are the challenges, how they work, and how easily they understand the HIV infection. If a person doesn't understand the HIV infection, then it becomes a challenge for the doctor as well as the parent to help him get the drugs properly. Well, if the child understands it properly, definitely it helps them to work with them and find out what are the things that can be done. So it is just not a way to start therapy for a person who is HIV positive. We should look under the hat of that particular person. What are the issues that he or she might be facing and might be there in the long run? So there are a lot of things that happen. I have been with such kind of young boys and girls, and they were in an NGO. I went there, and there they were told that since you are HIV positive, you cannot marry. So they took that in their mind that yes, definitely I would only have to take the pills, and I don't have any opportunity to get something in my life or something and work it up. So they have what you call stop their health, stop their mental as well as physical growth. But when I went there, I counseled them and made them understand they can get whatever they like, want, and they were very happy that they could cherish their dreams. And when they get a motivation, their adherence becomes better. They can get the treatment better way, and these people definitely can live a long life. They can live. People have lived up to 100 years also. But when in this particular age group of 13 to 24, they understand the infection, they understand the sexual behavior, they understand the different parts of substance abuse, they can shape their life in a good, what do you call, a good mapping map, and they can definitely add to decrease the HIV infection in society. I think it should be made mandatory for every person from the age of 13 years to 24 years to understand what is HIV, what are sexually transmitted infections, so that we can control the HIV. As from the past, as we heard from the NACO or other international guidelines, we have found out that when we studied and when we made them understand what is the infection, what is the epidemic, definitely even the brothels, people working in the brothels, they accepted the condom. They accepted the criteria of understanding that we can decrease the infection with the help of this condom. Definitely, the number of infections has gone down with that. So programs that participate with the healthy people to understand the disease are the ones that can decrease the infection, not just targeting the people who are infected to quick with that. Because the people who are infected are the end product, but the people who are not infected are the raw product, which should be focused in a proper educational way so that we understand the disease, the treatment, and decrease the infection in the society. So that's it.
Thank,
That's it.
thank you so much, sir, for answering all our questions. So that's all from our audience, sir. Before concluding, sir, any take-home message from your end?
Take home message for HIV is that we should try to understand the disease. Any disease that comes up in as was COVID, as we are now facing the mpox. It's not monkeypox, it's mpox. We should study on this. I think this should be the part that should be on the X or the Facebook. That what is this? We should get discussions on this particular thing, and so that we get the best of the knowledge. Right now, we are facing a new chikungunya dengue type of virus. So, as I heard in lately, in chikungunya dengue, they are mixture of that. The platelet is going down, but symptoms are of chikungunya. So, and it is more difficult to treat, or the patient's ability to work up in this particular patient is very difficult than the previous chikungunya or dengue. So we should understand the new diseases. We should the news, the forums, the online platform should participate, have a discussion of this particular type of infection, so that we can take good message from them, control it at the earliest, so that we save our time and money in the infectious disease part of our country.
Thank you so much, sir, for joining us today. And with your permission, sir, I would like to conclude today's session. Thank you.
Yeah, thank you very much.